Welcome back to Morning Mix. If your child is inattentive, wildly active, it may not be their fault. And for many, it's something that they don't grow out of. We are talking about ADHD, or attention deficit hyperactivity disorder, something that can inhibit lifestyles drastically.
So the question is, what can be done about it, if anything? We have Dr. Jessica Britt-Thomas, the Director of Integrated Behavioral Health Science at Wellstar MCG Health. She's joining us this morning with all of the information. So,
hi.
Hey, good to see you.
Good to see you guys.
So let's break it all down first, just with the simple question. What is ADHD and how is it diagnosed?
Yes, so ADHD stands for Attention Deficit Hyperactivity Disorder. It was formerly called ADD. You might hear some people still refer to that, but it changed when our diagnostic manual changed in 2013. It is essentially it's a neurodevelopmental disorder. It's diagnosed primarily in childhood, but it can expand to the adulthood, which we'll talk about. And it's a chemical imbalance, right? So the primary things that we do notice are inattention, difficulty planning, organizing, and then also the hyperactivity that we see with kids a lot of the times.
And that's some of the common signs and symptoms that we want to talk about. Are there any other symptoms that we should be looking for? Well,
so it's broken down into three different types of specifiers. So we have the inattentive type, which is one that we usually see with children, females, women, and girls. We see that. Males tend to be more hyperactive. The inattention is the difficulty just planning and organizing, staying on task. You hear those people that just can't keep up, misplacing items. The hyperactivity is more around the behavioral movements, right? So restlessness, the kid bouncing off the walls, right? The inability to stay in a conversation. Maybe you're frequent disrupting. You might hear someone say, sorry, I have to get this off my chest really quickly. That's more of that hyperactivity impulsive type. And then we have a third category, which is called combined. That's essentially having symptoms of both, which is not uncommon, but most of the time there's usually a predominant type that we see in children and in adults.
And we're referencing kids a lot. So let me ask you this. Can you outgrow ADHD?
That's a really good question, and the answer is sorta, but not really, right? It's a neurodevelopmental disorder. It's there. It's a lifetime diagnosis. What we see is people tend to adapt. So you learn what we call learning strategies. You learn how to work with what you have. A lot of the times adults don't realize they may have ADHD. That's something that they just felt like, hey, I'm not good at this thing. But what you see in adults is more so less of the hyperactive, more of the inattention. As work demands get more complicated, more difficulty, that inattention, that organizing and planning becomes a big factor. You might see someone who has a history of poor job performances, can't sustain jobs, and then also academics, right? You go off to college, you've been in a structured environment, and now you're on your own, and you see a lot of the times people have difficulty with those adjustment periods. So it very much is an adult diagnosis. It just looks a little different.
And now, that being said, is there a way to treat it or manage it?
So there's two primary modalities, right? So one is medications, right? Stimulants are the most common medications. They kind of increase that dopamine and norepinephrine and our chemical in body that we need. But the other part is the behavioral modifications. So children who are 5 and under or younger children, you may not want to start with medication. Some people are also looking for more holistic approaches. So IEP plans, individualized education plans you hear in school systems, 540s is also what they're known as. Developing structure, incentives, reward systems, those are very common and popular with children. Structure, routine, and then the same for adults.
Oh, that sounds really good. And so those were some general tips you can give parents, and let's just elaborate a little on that, but also for adults too as well. What can adults do like later on?
Right. So with children, we have a big team. You have a reinforcement around us. Adults tend to struggle. Again, you're kind of on your own. So the structure and routine are always going to be the #1 most common recommendations. But developing calendars, setting plans, right? Reminder systems, repetition, maybe asking for additional time or help. You can actually work with someone, a professional like myself, that can help you develop organizing plans and ways, looking at tasks from a smaller perspective instead of looking at the whole picture of everything that I have to do. There's also self-help workbooks. There's quite a bit of information that you can find online to help you just work on them on your own if you feel that you can do that independently.
It's a lot to take in, obviously, especially if you're dealing with ADHD. Let's talk about some resources or where you can go to find some more information.
Right. So the child and adult ADHD diagnosis, called CHAD for short, is one of the more common resources centers. It has information for parents and then also for adults as well. The CDC has resources. The APA, American Psychological Association, also has resources, and there's tons more that I think we're providing to viewers. viewers, but most of the time you can find a lot of those things just a simple Google search. They're fairly common, right? It's a fairly common thing we work with.
Okay, we have all that information right there just on your screen a minute ago. Dr. Jessica Britt-Thomas, we appreciate it.
Thank you very much for having me.